A Greater Boston starts with addressing a major disparity. A Boston Public Health Commission report shows a 23-year difference in life expectancy between people who live just 2 miles apart. The average in the Back Bay, 91 years. In Roxbury, less than 69 years.
Boston has some of the best medical care in the world, but not everyone has equal access to it. For more than a decade, a Dana-Farber doctor has been working to change that. And the results show this Changemakers program is working. Christopher Lathan didn't dream of being a doctor.
I wanted to be an astronaut, and then I wanted to be a scientist.
But life in a lab wasn't for him. At a mentor's suggestion, the Springfield native explored and then embraced a career in medicine. How did your parents experience healthcare?
Yeah, so my father worked as a machinist at Milton Bradley. The only time we realized he was sick is he didn't go to work one day.
His father died of congestive heart failure in his early 50s. And when his mother was diagnosed with early onset Alzheimer's, he saw racial disparities in healthcare firsthand.
I started giving my mother my card because the way that she would be treated when people knew I was a physician was very different from the way she was treated when she just went into the emergency room. Working poor folks of all races, but disproportionately black and brown communities that have not been able to get the same benefit of the incredible care that we have here, even though they're right here in the city.
Here at Dana-Farber, he set out to change that. He founded the Cancer Care Equity Program. And with a gift from the Kraft Foundation, Dr. Lathan designed a plan to give traditionally underserved patients access to cancer specialists where they see their primary care doctors, a program that's been running in 2 federally qualified health centers.
The thing that I really wanted to do is build trust.
And diagnose patients with cancer sooner.
I immediately said yes.
Harvard Street Neighborhood Health Center President and CEO Charles Murphy.
It's an opportunity for our patients to benefit from world-class care.
I'm feeling great.
Carol Walker's been going to Harvard Street for 50 years. She'd never heard of Dana-Farber. But when her white blood cell count skyrocketed, her primary doctor immediately consulted the Dana-Farber team on site.
That was vital. That was very essential, because if she didn't do it, I would be sitting here with maybe 2,000 blood counts of my white blood cells or whatever, or dead or something. I don't know.
Carol, who's legally blind, started treatment for leukemia.
How about any side effects from the chemotherapy pills?
What changes the most for the patients because of this?
Having somebody who truly advocates for them every step of the way. I think this is where oncology and social justice meet.
Ludmila Svoboda is the nurse navigator at the heart of the program, walking patients through the process at Harvard Street, in treatment and after.
The approach of humility and true partnership is the key to success. We form these bonds that are hard to describe because it's based on this mutual love and respect.
This is a way to be in the house with people and help them in a very direct way that they can see.
And feel.
I felt heard for the first time in the doctor's office. I feel so good because these people actually, they care.
And Dr. Lathan and his team are getting results. 12 years in, what do you know?
We did what we wanted to do, which is decrease the amount of time that people who have cancer, how long it takes to diagnose them.
The average time to diagnosis fell from 32 days to 12, which also speeds up access to potentially life-saving treatment.
We have a lot of folks that could use a program like this.
The president recognized Dr. Lathan's work, including him in a forum at the White House. And this year, his paper in the Journal of Clinical Oncology Practice spelled out the program's success, including the unexpected benefit of higher clinical trial participation for black and brown patients.
So she was familiar with the case even though she didn't know her.
Dr. Lathan credits his team with making the program work, while they point to his long-standing effort to get care to people who need it as their guiding light.
He's the visionary. Through his own lived experience, was light years ahead.
A doctor who's not at all sorry his astronaut dreams didn't come true.
I think it's what I was supposed to do. I know it sounds a little hokey to say that, but I think this is really what I was supposed to do. This is the work that I was supposed to do, and I love doing it.
And you can tell. He's also proud that the program is giving people the word more quickly that they don't have cancer. They get that in those centers as well. The team's been involved in developing other programs too, including an oral medicine and a nutrition program.
And sometimes people wonder, like, how much can one person do? He's doing so much for so many people. Really wonderful.
Yeah, and you know, starts that and then spreads out to the team, and who knows where it goes next.
Great story, great doctor. Right back.